Well, hello everyone, wherever you are in the world, and thank you for joining us. My name is Duncan Spencer. I'm the Head of Advice and Practice, and I'd like to welcome you to our series of COVID-19 webinars hosted by the Institution of Occupational Safety and Health. IOSH members worldwide continue to lead the way in enabling businesses and organisations to respond appropriately during this crisis. They continue to protect colleagues and prevent ill health, as well as helping millions of workers adapt to new ways of working and the new challenges that brings. We're proud of how we as a profession are actually responding to this pandemic crisis. But worldwide, around 1 billion people suffer from mental ill health. Anyone, anywhere can be affected. Depression and anxiety are the leading causes of illness among adolescents, but also adults. Suicides claims the lives of nearly 800,000 people a year. That's one person every 40 seconds. And it's the second leading cause of death for young people aged between 15 and 29 years. The COVID-19 pandemic has caused many pressures for millions of people this year. Anxieties connected to occupational infection risks are just one of the countless work-related and personal stresses many are now experiencing or are likely to experience at some point in the future. As we enter the winter months and experience a resurgence of COVID-19, staff working from home may feel more isolated and unemployment rates are on the rise, which can often affect family situations. With these kinds of social pressures blurring into our work lives, how can we help our colleagues to cope and stay mentally well so they are happy and productive in all aspects of their lives? We have touched on this subject in other IOSH webinars, but we make no apologies for doing so again. It remains a hot topic for many members. In the next 60 minutes, our panel will look at the psychosocial risks and mitigations and ways to support workplace mental health. So let me introduce you to our panel today. We're delighted to welcome Peter Kelly. Peter is the senior psychologist in the United Kingdom's Health and Safety Executive's Health and Work Unit. Peter is a technical expert on mental health and well-being and prevention of work-related stress. His LinkedIn account yesterday indeed flagged that he has been with the HSE for over 20 years. So that's some dedication. We also have the pleasure of welcoming my colleague, Mary Ogungbeje. Mary is the OSH Research Manager at IOSH. Her activities in the last 17 years at IOSH have involved program and project management, research monitoring and evaluation, training, public speaking, publishing material for both scientific and non-scientific audiences. We have some pre-prepared questions for our panel to get us going, but we hope to answer some of your questions too. So please take this opportunity to submit them through the webinar and we will address as many as we can. I'll be watching for those questions coming through and picking those up so that I can pass them on to the panelists. So let's kickstart today's discussion and go to the first question. So Peter, if I may come to you first, please. Just 2 weeks ago, you posted on LinkedIn about the fact we need to act now on this issue, stating, and I quote, "We don't have the luxury of dealing with this later." You said we needed, quote, "a revolution in the workplace of compassionate support." Additionally, this week, we've also seen quite a lot on the United Kingdom's BBC channel running some news items around loneliness and isolation and how the COVID-19 lockdown measures are making matters worse. So what are your views on this, and how can occupational safety and health professionals, and in fact all employees, play their part?
Well, hopefully you can hear me okay. I've had to get very close to my internet connection, so I'm downstairs in my lounge, which is nice actually, because I'm consistently up in my office doing these webinars. And that's the first thing I really want to talk about, is actually the way we work and how we work has changed, hasn't it? You know, we're actually stuck in our home offices and a lot. But with regards to isolation and loneliness, we're seeing that as an emerging theme heavily across all countries as we go into this second wave, a significant period of lockdown. But what we need to remember is in the first wave, it was relatively new. We'd know what to expect. So there was a sense of we'll get through this, and then once we're through it, we'll be okay. But now a lot of people are like, oh my God, we're into a second wave, and they know what's coming. And that is actually starting to cause a lot of people to be concerned, you know, because if you do, like myself, I live on my own, and the only people I see are the people I go out when I go out for a walk in my park, or the birds that I talk to in my back garden, which I now feed and given them individual names as well. So my point being is actually now we really do need a revolution of compassion. Why is it we show compassion to our family, to our friends, and why should we not be doing the same principles in work? We need to show compassion because actually it's a basic human need and it's a human trait. And actually being compassionate and caring and understanding of your colleagues can be the difference. For some people, it is possible to spend 2 months, if not longer, and have no contact with anyone from their work. But prior to this, they would have been the people they would have seen on a daily basis. So I think it's really important we have to look at what we do and how we support people. If you do a Zoom meeting like we're doing now and simply do the Zoom meeting and then get off and don't really ask the question, how's everything going? You know, on a score of 1 to 10, where do you feel you are? You don't really know. You don't know what's happening to your people, and you don't know what's happening to your colleagues. So one thing I put on LinkedIn is called the 6 challenge. Contact 6 people over the next 6 months, because we have to be 6 feet away from them, and it's identify people that you can talk to. So that's how you start compassion. You start it by having conversations. There you go.
Thank you, Peter. Mary, have you got anything to add to that?
Really just to say that I completely agree with what you've said, Peter. I think it's really important for people to be mindful of others around, you know, within their networks, including their colleagues. And being mindful isn't just asking, you know, how are you today, and that rhetorical kind of question, but it's really about demonstrating that you really are concerned and you really are thinking about them as an individual, as a colleague, and even proactively engaging with them. So not just the, you know, the meetings that are set in the diaries or, you know, in your calendars. It's about being aware of maybe their personal situations, their personality types. You know, some people are a lot more, they tend to like interacting and socializing with others. So if they don't get that, they may be struggling even more. So it's about being mindful of their personality types, the way that they like to work, and perhaps adapting as a colleague or as a manager to those individuals.
What's really interesting, Mary, though, is actually the people that we thought were emotionally resilient and capable of working on their own are actually struggling as well. And I think that's, you know, this is the fascinating thing about enforcing people into a situation where they don't have human contact. I think I spoke about it in a slide that's coming later. Human connection is fundamental to who we are as people. We go to work for connection with the people that we work with. Some of them we will like, some of them we won't. That's the nature of life. But the point is, at least we have the choice. And at the moment, that choice is not actually being offered. So I think what we need to do is to remember, even if you enjoy being on your own, there's a point when you don't, and there's something that we as employers and as mental health advocates, we need to do something to promote the fact that it is a wide-ranging issue at the moment.
So Peter, is now a good time for you to talk us through the model that you posted on your LinkedIn message?
Yeah, absolutely. Please do. Yeah, thanks. It should come up.
Yep.
Okay, so we put it onto, there we go. Yeah, so effectively, well, I'll take you through this, but basically, this is based on what happened when you prepare soldiers, special forces, as they go into conflict zones, okay? So it's about the fact that you're going into an unexpected, unknown outcome. So, So what you see here in people as they go into conflict zones is you get a rise, a very significant rise in their anxiety. That's that first wave, okay? Now what we're seeing on the first wave, which is very strong rise in people's mental ill health, yeah? It's going up, and then suddenly we get into this position where we're locked down and we have to, therefore we've got to adapt. So mentally, we adapt to that situation, okay? But what I want you to notice, and I need it, is look how sharp, and look at the line that goes, the dotted line that goes, which is a point when you start to see an impact. Look how sharp the impact is when you come out of that period of lockdown, okay? So we got into this period, this second height or second wave, using the term that we have at the moment, fairly quickly back in July as we came out of it. Where we're now, though, is we're back in this again. So we've got this heightened anxiety, heightened level of concern that we're going back into another lockdown. But the difference between now and 6 months ago is we know now that this could be for 2 months. We might have a period and then we might have to go back again. So what we're starting to see is different mental health concerns arising. So those that have gone back into work are now faced with the possibility they may not be able to go into work. Those that are key workers that have worked through it know what the virus has and what it can do. And so mentally, the mental preparedness of our employees is going to be directly impacted. And what isn't shown in this graph, but I will develop it, is there are mini spikes in the adaptation. Yeah. So as you're adapted, you get mini spikes of like, this is just a really bad day. Now, for example, 2 weeks ago, I had a bad day. I got up, I felt quite upset by the day, and I went for a walk. So you have these mini spikes that are always going to be there, and they're going to increase during this period of time. The longer we stay in lockdown, or the longer we isolation kicks in, these things will be there, and we have to turn around and use this time to fundamentally look at how we manage people's mental health in work. You are in work 40% of your life. You're asleep 40%, and your 20% is awake. Okay, the people you work with, you will see twice as much time in the past as you as you are with your family. So getting mental health right, above and beyond teaching people to be mindful and resilient, is important. Do that, but do the organizational bit. Sorry, I'm probably jumping ahead, but I think this slide really emphasizes in a clear way that we're back in it, and we can do something. Thank you.
Okay, thank you. So if we can cut the slide, please. Thank you, Peter. Just picking up on one of the points that you were making in there, then, what are your views on this as a statement? Do you think that the focus on the physical controls to try and prevent transmission of this disease in the workplace and in public places and so on and so forth is actually that focus is hiding the true levels of mental ill health in the background, that it's also being generated by this? Is it a poor relation in that respect?
I think it's interconnected. If you want to look at creating COVID secure workplaces, then you have to consider the psychosocial or the human elements to what makes people comply with COVID security. And that's why in the UK, in our recommendation for doing a COVID-19 secure risk assessment, you include stress and mental health, because actually what you want people to do is to follow the physical interventions that reduce the potential exposure to the virus. But what you need to do is remember that people are people, and actually you've got to address the psychological and the sociological elements. Work is inherently about has a high degree of social element to it, doesn't it? You go into work, you form friendships with people, you connect with people. And one of the things I've done, as you know, right from the outset, is I run a coffee at 2 o'clock with Peter, which I'll be doing today. And that's just to give people the opportunity to cut away have a cup of coffee like they would do in their normal office. And I'm privileged to see what other countries are doing and talk with colleagues in different countries. And we're all coming to the same conclusion, which is the mental health of our people is potentially keeping people mentally healthy is part of that of getting people through the COVID-19. The other aspect is if we don't keep them healthy, we will have a generational issue with mental illness. And that's what we're seeing now. I don't know if you've taken a walk in the park and you see 4-year-old children who run away when they see that someone that doesn't have a mask. Psychologically, what is going to happen in the future? And we've got to really take consideration of what the mental health impact in terms of the negative mental health impact is. So I guess I've answered your question, which is I think you need them both, and you need people to feel that they're cared for at work. That's why I talk about compassion and authenticity. Don't simply just say, "How are you?" if you're not prepared for the answer.
So that's come over loud and clear that actually they're not two unrelated topics at all. They're absolutely intertwined, interrelated. So let's change tack slightly. So Mary, if I may come to you, the principle behind the law in many countries is that prevention is better than cure. Has IOSH research considered what kind of elements would be needed in a mental well-being management system that will help with that prevention?
Yeah, absolutely we have. So we put together a tool as part of our launch on the findings of our research into mental health first aid. And this tool highlights various elements that organisations should be looking at, and it includes things like leadership and commitment. So we hear that quite often, but it's what actually drives and maintains positive change in the workplace. It includes things like policy. So like a well-being management system has similar elements to any other type of safety management system, and so intent must be set through that policy. It includes things like accountability. So arrangements needs to be in place that clearly state different responsibilities throughout the organisation, and that managers and workers are held accountable for delivering them. And then also things like collaboration. It highlights about collaboration, internal collaboration between colleagues, for example, to organise a back to work plan and address work related reasons for the illness that's going to be needed. It highlights things like competent workers and managers. You need to be, you need to basically be competent as a manager and even competent as a worker to know what to do in your roles and how to support yourself in terms of your well-being and colleagues.
Yeah.
And then also things like controls, several types of controls as well. So you've got the prevention controls, which are things about like, does the organisation have assessments of the stressors that's present in the workplace, execution controls, which are things like, are managers actually able to spot the early signs of mental health issues, and recovery controls. So things like, how does the organisation, when it comes to return to work, how are they collaborating with colleagues such as those in HR or line managers or even occupational health. And then I think also
sorry, go on.
Lastly was the key thing is also about measuring performance, because it's quite often that you put something in place or you have a strategy, but you don't actually know how effective it is. So measuring performance is also touched on in that tool.
Yes, and as I would add, which would probably make you smile, Mary, I think you've got to be careful what you're measuring, because it's very easy to measure outputs, but what you really need to measure is outcomes in all of this. Peter, as a representative,
you basically have to measure, and for too long we've not measured mental health and stress. We took it as a secondary place, and guys, the people who are stressed have accidents They engage in ill health behaviour. People who are suffering mental ill health because of pressure at work are doing exactly the same. So having, as Mary said, having systems in place to monitor, manage and control that is as much as the safety management system. Why do we say safety management system and got safety management and health? It's just as much important, and it's not purely asbestosis or respiratory disease. It's that 1 in 5 people experience a common mental health problem. The numbers for work-related stress across the globe are systematically going up. So me, I'm always on about prevention. But sorry, you're going to answer the question, and there's a question in here. The management competency framework, which was developed by Emma Dolson-Fielder, is a good way which we work with IOSH. It's for that question that was in here. So we have a look at the management competencies for work-related stress by Affinity Health at Work and Emma Dolson-Fielder. Sorry, Duncan, I've jumped in, you know me.
Not at all, Peter, not at all. So I was going to ask you really to put you in the shoes of your colleagues in the Health and Safety Executive as a legal enforcement body. So what would your colleagues be doing if they're visiting a business? What are the elements of a management system would they like to see? And in particular, what would they see the line manager's role to be in those organizations?
Thanks for that one, Duncan. That's a nice drop in, isn't it? What do they want to see? Well, there's a basic core principle to managing people's health and safety, isn't there? Which is actually, you need to know where your risks are, you need to identify them, and then you need to do something about it. It's the basic. So, for example, our legislation over here requires you to do a risk assessment for those things that you expose your workers to. The Section 2 of the Act requires you to protect people's health and safety at work. Reg 3 of the management regs requires a risk assessment, and Reg 7 requires that you do something about that. Now, every other country has similar regulations, and here's the time and the choice of what we do. As at the moment, we do the COVID secure workplace assessments, which is predominantly, plus we investigate serious and fatal accidents, okay? But the expectation is we will ask you, what have you done to make the place COVID secure, okay? And if you have made something COVID secure, to what extent have you looked at the mental health of your workers? What are you doing about maybe recognizing this is a really difficult time? And with regards to, there's a second part to the question, wasn't there, Duncan?
Yeah, line managers.
Now, with regards to line managers, actually, for me, to manage mental health and to manage people's sense of work-related starts with three basic principles: eyes, ears, and mouth. Yeah?
Yeah.
They're all senses that we've got, and they're all senses that we can use when we're looking at how we manage our people. Look around and ask, why is somebody behaving in a different way? As a good line manager, you should be checking in, and you can do that on Zoom or on Teams, whichever. But if you go in and simply do a meeting and say, right, the meeting's done and we go, you leave that person thinking, I haven't had connection. You've got to contact your people, have one-to-ones, do it online, have a cup of coffee with them. If you're so inclined, have an online beer, as I do with my boss. But having that informal social stuff is really important. I've constantly, you know me, Doug, I've gone around this for years, right? Why do we switch off human emotions when we go to work? Yes. Why do we treat people differently, that we spend more time with than the people that we live with? I don't understand. And that's what this pandemic is really showing up, is people feel alone. They feel isolated, even in an environment where because they're not having that connection.
Yeah, that's a first-class point. I'd like to pick up on one of the technical points that you made as well, that adds to some of this confusion that often surrounds in all countries, where we're getting government advice on this and regional advice on that, and there's so many differences and the confusions. I think it's true to say that while it is important that we all consider what common practice is, our risk assessment also needs to show what our local differences are, and that might push us to actually modify some controls or change some of the ways in which we're doing things in order to be able to protect individuals and to stop transmission and such like. So there is no golden rule out there, is there? There is common practice, there is good practice, but we have to actually reflect our local circumstances too.
You've got to look at your situation,
yes,
and understand it. I mean, Jason Rose here makes a really good point, which is, about the fact that mental health is coming onto people's radar. Guess what? For 7 years we've done health and well-being, and if it's not on your business radar now, where was your head?
Yes, yeah, indeed.
In the sand, because I tell you now, if there is a time when you need it, when you need to have people's mental health and their physical health strong, it is now. And I think, actually, there's some wonderful work in the construction industry. I know Jason's from the construction industry where they've done that. But yeah, you've got to look at your situation. What systems do you have and what processes you have? You haven't got a risk assessment. How do you know where your problem is?
Yes.
You have got a risk assessment. Why aren't you doing anything about it? If I go in, I'm a warranted inspector as well as a senior psychologist. If I go in and there's no guarding on the machine and there's a risk assessment that there should be, then it's very easy. It's an easy breach for me, isn't it?
Yes. So a couple more questions from our preparation, and then I'll start to feed questions from our audience. So Mary, coming across to you, I'm also conscious of the fact that even with the best will in the world, sometimes people slip through the net and they end up being anxious, depressed, and needing medical attention. It might well mean that they're off sick as a result of that. So IOSH has done some research in around rehabilitation and returning to work after common mental disorders. So I was wondering whether you could just summarize 1 or 2 points from that research that might be helpful to our audience to consider, please.
Sure. So there were 5 themes, actually, if I can slip 5 in rather than 1 or 2 points. There were 5 themes that came through that made, according to the stakeholders that were involved, that were central to a successful return to work process. So one was the workers' motivation to actually return, as opposed to the emotions that they were feeling and how they were actually coping. And then the other was the type of work that they were returning to. So whether they found it to be satisfying and fulfilling. So those that actually felt that there was value in the work that they were doing and had some satisfaction, they were more likely to return to work quicker than those that didn't. Another theme that came across was the importance of there being a safe, welcoming and stigma-free work environment. So, and this is where the whole, health and well-being management systems comes into place, and, just driving that safe and open culture for workers to be in. So if there was a safe, welcoming and stigma-free work environment, then people would be more inclined and feel encouraged to go back. Another was having that personalised return to work support. So it could be, and I think this is where it's really key in terms of the role of the line manager as well as colleagues like in HR. So having that personalised support in terms of them as an individual, how resilient they were, and how quickly or the phasing that they'll be coming back into the workplace. And then the 5th was about collaboration between the professionals that were involved as part of that process.
Okay, thank you, Mary. So anything you want to add to that, Peter? Any reflections on?
No. Okay. Can you hear me?
Yes.
You might have lost you for a sec. No. Okay, right, we're back. I'll get this one in quickly. 45,003 ISO standard that is coming in July 2021. That will hopefully put around the application of the safety management system to health issues. So I think that will be a practical tool that will help. It's guidance, it's not a defined standard. Okay, so it's guidance, but it will help in actually putting a system and structure around. Do the risk assessments, identify where you have a problem, put interventions in place, prioritize mental health as a KPI, make it a key performance indicator of your company, put it on the board, and I think that's really, really important. Destigmatize mental illness in your workplace. Make it okay to talk about how you feel, and when you don't feel great, to be able to say, I don't feel great. I did that on 2 weeks ago. I just turned around and I brought my people in and I said, I'm having a bad day. And actually, by doing that, I was being authentic, and I was showing compassion to myself. And I think that's really important, is that remembering that, we need to apply the same principles to ourselves as we do to organizations,
Yeah.
Yeah. Okay.
Thank you very much. So you just answered Chris Rapson's question, because he was asking about the links to ISO 45003. So thank you for picking that up, Peter. There's one here that would be interesting for you, Mary, from Steve Hiley, who says, what experience do you have of mental health first aiders supporting employees who are now working from home or furloughed? So I don't know whether we have anything direct about that, but certainly we have some research in that field, don't we?
Yeah, so not specific in terms of the furlough and etc., but certainly in terms of the research that we did with mental health first aiders, and the role that they can have in an organisation, as long as it's part of that holistic, wellbeing management system. With, I guess, the key thing about the role of mental health first aiders is that they're not there to treat, so like a first aider who's there to provide that immediate and potentially life-saving treatment before further medical help arrives. A mental health first aider is not in that bracket. So they are there, however, to respond by listening and advising, and then signposting colleagues to other supports and services. So there is a role for them within the workplace. Some points that the research that we did drew out was that organisations do need to be mindful if they are introducing them into the workplace, because not everyone will necessarily be suited to take up that role as a volunteer. Yeah. So there should be like a selection process, for example, just to identify who's more perhaps resilient and suited for that role. The volunteers themselves would need support. It can be quite, it can actually have an impact and affect the individual as a volunteer themselves. So there needs to have that, perhaps like a buddying system, to be able to relieve some of that, that pressure. And then things like having a coordinator would be good to help lead that mental health first aid network within the organisation, and keep records of things like training, or keep records of input by volunteers to colleagues.
Yeah, I mean, the primary role of them is to signpost. Yes. There are in the UK 280,000 people have been trained as mental health first aiders. Across the globe, there are 20 separate initiatives around mental health first aid. So it is out there, and it is part of the equation of how we use that to support people and to signpost them on beyond their mental, when they're in a mental health crisis, or they're beginning to tip towards that. And absolutely.
Oh, Peter's frozen. Are you still there, Peter? He's not sitting close enough to his Wi-Fi, I'm afraid. Hopefully he'll come back in a moment or two.
I'm back.
He's back. He's back.
Yeah. So the supervision is absolutely pivotal, that you supervise your mental health first aiders, because if they're taking a call on a Saturday night at 8 o'clock from a colleague who's extremely distressed, there is a point afterwards. Well, what do you do with where does the mental health first aider go? I've got fibre optic here, so I have no idea when this is doing this, but I do.
We'll persevere, don't worry. And there's an interesting comment raised by one of our audience, a lady by the name of Joanne Price, and I'll read it out to you, and you might wish to comment further, Peter. She says, Joanne says, I've worked for myself on my own for nearly 18 years. I thought I could cope well working on my own, but I have to bear in mind that I was visiting client sites, and I have stopped that during COVID. I've not been able to go to those client sites. And it's highlighted just how much I talk to client employees while I'm there. You know, we will chat about the TV we watch and our families and things that are going on and so on. And she said that now she's starting to feel the effects because she doesn't feel that Teams and Zoom and that sort of thing gives her the same kind of connection with clients anymore. So actually she's feeling more isolated as a result of not having those kinds of carefree discussions in and around business, I suppose.
Yeah, I mean, that is what is coming through and through all the time, which is actually the informal nature of work and business met those sort of emotional needs. You are welcome to come to my 2 o'clock every Monday to Friday and have a coffee with me and have a chat, because that's what it's about. But why not each of you do that? Why not set up a group of friends you're going to regularly check in with, okay? And if you know they're a consultant and they're working on their own and they're used to being people, you phone them up and you say, hey, whoa, how mad is this? You start it by just having a normal conversation. You might want to not say mad, but you know what I'm trying to contextualize it is we need to create informality with informal environments. Now, we did this naturally in the kitchen, in the office, or hanging over someone's desk. I never sent emails. I walked to people's desks and I talked to them. They basically think I'm not doing as much work because I'm not doing the email, but I'm doing more work because I'm having social connection. And I think it's find creative ways to do that. Now, if you are on your own, like me, I go for a walk and I walk for about an hour around the park that I'm in. And I stay socially distanced from people and I give them a wave and I connect and I have a moment of human connection and connectivity. And that for me builds me up. And then, you know, I've had to find sort of creative ways, but I understand totally, Joe, where you're coming from.
Yep.
You know, I've spent 10 years traveling around to suddenly go, sit here, Pete, in front of this box and do this. It's a very, very, very different world. But yeah.
It's certainly what my elderly father does. You know, he loves to chat, and the fact that he's having to safeguard himself is driving him potty.
Informality in the formal situations. That's what I'm saying to people. Make it different. If you want to have an informal meeting, have a glass of wine when you start the meeting at 5 o'clock. It's okay to have a happy hour, to have a glass of wine or beer. That's the kind of thing I think is really, is really, really important.
There is, while we're talking about people who often we just don't think about in terms of how they're affected, you know, like the self-employed, the sole traders and such like. There is another comment here from Louise Hoskins, which I think is our president-elect, unless there's another Louise Hoskin. And she points out the fact that we often forget another group of people, which is actually the leaders within the organizations. So, you know, the leaders also have the same kinds of issues to deal with, yet we expect, because they're leaders, that they deal with it for themselves and so on, which often isn't the case. So I don't know whether you've got any comment on that, Mary?
Yeah, I mean, I'm nodding away because they often say that it's lonely at the top. You know, you don't have that kind of peer-to-peer person within the organization that you can, I don't know, perhaps, it depends, maybe let down your guard with, or, you know, be vulnerable with. So so it can often be quite difficult for very senior management, people in those positions, really. But I think the same applies as to everyone, really, when it comes to your mental well-being. You need to take care of yourself, and colleagues needs to be mindful of you as a senior manager in terms of your needs and how you're doing. So it's just about taking care of each other, really, regardless of you know, where you are in terms of the structure of the organization.
And I, you know, one of the things I've done, I'm a mental health advocate, a leader in mental health. I don't feel like that. This is something I've been doing for 20 years, but anyway, I had to be real with people on LinkedIn and go, this is a bad day. And I missed not being able to hug my dad and hug my friends. But I have people around me, and I think it's that authenticity as leaders and is really, really important, that we are authentic in how we talk to people, and that compassion isn't like a built-in thing. It's something which comes quite naturally. And we're talking with Richard Cruddas from BT recently, and I speaking with their team, their directors workshop, and I said the same thing: be authentic, be compassionate, because that's what people want. And as leaders, it doesn't take much to have those. Why? Because we're authentic and compassionate, human emotions. And I always bring it back to the fact we have these skills, but we say, oh no, I don't think we should show them. And vulnerability is there. You know, it is vulnerable to sit up and say, guess what, guys? I stand on a stage for 10 years and tell you it's okay. But actually, all of that, all the skills, all the knowledge didn't matter on that Saturday morning. I went for a walk because I knew I needed to get my head into a different place, and it helped. But I think, if there is one thing to take away from it, be authentic, be compassionate, create informality in formal settings, make work a place of support, because that's what's missing at the moment. We don't have support. A Zoom meeting for some people is not support. It has to be something more than that, you know?
Yeah. So this brings us on to something which Samantha Coronda is talking about. She says, I work for a big freight company, and we have multiple stations across the UK. Many have been hit hard by the COVID virus through people having to go into, voluntary lockdown and so on and so forth. She says that even though there are many people suffering from their mental health as a result of this within the organisation, she feels that they're often too scared to ask for help from senior management, and that there is a difficulty about management direction. So I think what she's pointing at is the stigmatization, perhaps, of that mental health still has in the workplace. So Mary, would you like to say anything around how can we work on this stigmatization aspect in businesses?
I think a good place to start is having policies, really, and then also having policies that aren't just they're in theory, but they're actually brought to life. And it's it's everyone who has a part to play in that, but particularly, for example, managers, because if they're the ones that help to cultivate a safe and open environment to workers that are on the ground level. And I think if people are aware that they can speak freely without being penalised, without being judged, that they're not up to the job, then they'll talk more freely, and they will be looking to their colleagues, for example, managers, to support them in that area. And managers should be open to, not just open, they should actually be demonstrating that by supporting anyone who comes forward and supports them. And that's how you create that safe, open culture, and basically drives away stigmatization.
And then the other thing you can do is take a week's worth of papers into the chief CEO or the board of directors, and drop them on the table and ask them to read it. Every day there is stories in there on the impact of COVID-19. Every day we get a report on the impact of this is causing on people's mental health, and ask them, how are we immune to this? Because you're not immune to it. And it is having that conversation. It is and I know this, but it can be a really awkward situation. How are you? I'm fine. It's a closed question. How you know, on a score of 1 to 10, how are you feeling? Oh, I'm about 7. Okay, well, 7. Okay, so 7's not that. Do you understand how you change you just change the dynamics? And then be prepared. Do not ask the question, "How are you?" if you're not prepared to sit down for 15 minutes or 20 minutes or half an hour and have that conversation with the person. I'm very lucky. My boss phones me up most days, mostly to take the mickey out of me and ask me how I am. But that's really important because he knows I need that contact, and I think that's about him understanding my needs as an employee, and his as a manager for understanding what needs to be, what needs to be done. Yeah.
Yep. There's another minority group, but minority, of course, in numbers, but not in terms of importance, that's been pointed out by Nicola Penman. She says, I have noticed that some people on the autism spectrum are really struggling and need us to react with them. A smile, a hello can result in a conversation they might not normally have. So, again, there are people vulnerable within the staff of organisations that have additional needs that need to be addressed. Kate Bevan Marks asked the question about how IOSH feels they can help to influence employers. Well, Kate, I would point you towards our website and all our free materials which are there, which help you to form the arguments and to present the case for doing something about this. And of course, there is the results of this webinar which you're sharing with us at the present time. There's one here from Nicholas Oikonomu. As a master mariner, I am facing issues with regards to my crew members who have been on board for more than their contract. Could you advise means on helping them in their well-being? So, Mary, I think this is one for you to pick up because we had some research in this area recently, didn't we?
Yeah, absolutely. So we did do some research with Cardiff University on this one, and it specifically looked at the well-being of seafarers. So quite often there's feelings of isolation, loneliness, the things that we've been talking about already, things like fear of job loss because of the contract situation, being separated from family. These are all predisposing factors to seafarers' mental health. So in terms of the findings, it was things like where an organisation, where a company was proactive, it was asking individuals, or it was encouraging individuals to be proactive for themselves. So, providing them with self-help guidance, or perhaps they were giving reactive services in terms of counselling. So what was quite noteworthy was that in terms of the company being proactive, there was a lack in that direction. So, for example, I think it was around 55% of employer respondents stated that their company hadn't actually introduced any policies or practices that were aimed at addressing the issues of seafarers' mental health in the last 10 years. So that says a lot in terms of how there was a tendency to address mental health and well-being within the workforce by giving them guidance to help themselves, or reactive type of measures, but not necessarily looking at it in a holistic way and looking at policies and practices that can address many of the issues that the seafarers were facing. Yeah.
Okay, thank you very much.
Pete,
go on, sorry, Peter.
I was talking with someone who they've had people out on the rigs, oil rigs out in the Arab Emirates, where they're 90 days over their recommended time because they couldn't come back, and actually about doing bespoke support systems for people in that. So there were a number of people in different roles where actually they have been stuck in places, and companies have to do above and beyond simply meeting and saying, or they have to look at the resource that they put in, how they support those people, etc. So it's a great question, and it is, we forget that. We forget the mariners, we forget the people out out on the rigs who, and actually some people haven't been home for nearly 6 months.
Can I just add
Go on,
that
Mary.
that piece of research, there was a long list of recommendations, that can be implemented in a sea vessel. So it's worth the person who asked the question having a look at the report and looking at those recommendations.
Which is on the IOSH website, isn't it?
That's it, yeah.
There is a number of questions that have popped up about something you said earlier, Peter. I'll read out one example. Yusuf Kadikon said, are there mental health screening assessment tools for employees? So when you were talking about measurement early on and measuring people's mental health, just how do people do that? Is that something for a specialist in occupational health, or is that something practitioners can do?
Well, there's the generic ones that the management standards, which will allow you to identify where you have stresses that may lead to mental health. There are a raft of screening tools out there. I would always encourage you to use a screening tool that isn't top heavy, so it has 40 questions in. Hospital anxiety depression scale, for example, only has 12 questions in, but it gives you a measure of where people are on there. It uses a clinical tool. What you might want to consider is the 5 questions from the WHO on well-being, which is a really good, quick dip into your organisation to say, well, how are your people? How well do they feel their well-being is? So there's that 5 questions that you get from the WHO, World Health Organization. There's the BECS, which is specifically for depression. So yeah, there are different tools, but I mean the measurement side is just one component of it, isn't it? What if you measure it and do nothing about it?
Yep.
Actually, the biggest identification is your ability to listen to your people that you're managing, or you as an organization reach out. There's a question about KPIs. What would a KPI look like in an organization? It's one where actually the organization reports back to the board and to the people that own their shareholders about what they're doing on managing people's health, mental health. What have you done this year? Not necessarily what the return on investment will be, which by the way is there. You can get return on investment information from the Deloitte report, which tells you. But if you say this is a reportable thing to the board, then that will get priority. So KPIs are about what you've done, where you did it, and what impact it had by doing, informal evaluation. That's what you need to, because if it's just, oh, this is a nice thing to do, but we'll see, it doesn't take the priority, does it? Farmer Stevenson, in their report on the core standards, which is a UK-based report, Stevenson Farmer, because they didn't want to be called Farmer Stevenson, because the association with being a farmer. Stevenson and Farmer, the review, put in 6 core competencies, which included a mental health plan. You, as a KPI, why not report on your mental health plan?
Yep, absolutely. So we're coming to the end of our webinar now, and
Mary looks like an angel. She's got this.
I am.
But it's just illuminated. I feel I should be in front of a mirror for a window. It's dark. It's dark up in Lancashire. It's great.
When I'm in sunny London.
Okay, so we're coming to the end of the webinar now. There's a couple of things that I'd like to mention, and then I'll come back to you both for any final comments. Mary, I'll start with you, and Peter, you have the right for the last word. So I just wanted to mention and pick up on a point around line managers, because in a recent survey that IOSH we found that 69% of line managers had not been trained in how to recognize poor mental health in their employees. So, there's an action point that many people can take away and ask that question. In the midst of a global pandemic, the ability to recognize employees' mental health is more integral than ever. Line managers have a fundamental role to play in the promotion of positive mental health at work. The positive impact they can have on the well-being of their direct reports is huge. IOSH's Managing Occupational Safety and Health course can help to achieve just that. This course can help managers understand why it is important to manage fluctuations in people's health, what needs to be considered in a health risk assessment, and also gain the tools and techniques to improve the health and well-being of their teams. So if we can now go back for some last words from our panelists. So Mary, if you'd like to give us your final reflections, please.
I guess for me, it would be, I would say, like acting in your role. So whether whether you are a health and safety professional or a line manager, or, you know, whatever role you are, act in your role in its fullness, so that where am I going with this? So that you can be as effective as you can within this situation. And just to elaborate on that, I feel like the role of a line manager, for example, is really influential and quite a privileged and powerful role, because they can really influence the experiences of those within their team. And I think if you are acting in your role as a line manager, not just by focusing on, you know, deliverables, but by focusing also on the well-being of your colleagues in your team, and supporting them and monitoring, you know, how they're doing, and being genuine in terms of when you're asking those questions, because people will pick up on that. That will really change the culture, that will change the experience of the individual, and that will help workers feel supported during the season.
Thank you very much. And Peter, in a couple of minutes, if you may.
In a couple of minutes, sorry. This is my Hyde Park moment. No, there's just a couple of points. Be authentic, be compassionate, okay? We need that now. Do not let the legacy of this pandemic is a generation of mental ill health, okay? We must step in, and we must look after our employers and our family and our friends' mental health, yeah? I think that's really, really important. Create informality and formal situations, okay? Make it okay to have a beer or have a coffee, or to do whatever it is that you know, and why not do it? I did a Zoom walk with my while I was out walking in the park, because I've got an iPhone and I've got something else and I could do that. So there's creativity in contact and communication is there. Look after the people and they will look after you. Really straightforward concept, isn't it? Look after people's mental health and they will look after the business that you're in. And I deeply believe we have an opportunity to take the focus in health and well-being and change it back to what it should be: individual, secondary, and the primary. What are you doing at an organizational level about how you manage that? What do you do to train your line managers, your secondary and tertiary? What do you do when people need help and support? Yeah, and what skills do you give them to help them to cope? Which is me saying, you can do mindfulness training, you can do resilience training. If you do that and you don't do the organizational bit, remember what it was like in the 1990s? Well, Duncan, maybe from the 1990s.
Thank you.
We had this thing called no, we can't possibly be. We had this thing called coping, didn't we? And for me, a lot of what we do at the moment in health and wellbeing feels like coping. It doesn't feel like actually it's authentic organizational change,
making headway.
And that is where we get in the movement. We will get through this pandemic. We will get people through this, but we'll only do that if we do the organizational, the training, which is the secondary, and we do the tertiary. And just simply phone 6 people, okay? Commit to talking to 6 people over the next 6 months. And you're all welcome to come into my coffee. I will be here until this thing goes. If it's here for another year, I'm still going to be there at 2 o'clock Monday to Friday. But I do it with other people. It is really an easy thing to do, to commit yourself to spending time with people.
Thank you, Peter.
And if you want to know about my birds, you can ask me at 2 o'clock.
Yes, and what all their names are. My thanks on behalf of our audience today to our learned panel, to Mary and to Peter for such fantastic insights. I think the message is coming over loud and clear that humans are a social animal, so we need to be social, and we need to be compassionate in that sociability. So many thanks to you all for participating today. We will send the audience a link and the recording of this webinar via email. So please look out for it in your inbox. In the meantime, you can catch up on our previous webinars from the IOSH events page or YouTube channel, and the latest in the COVID-19 webinars series, and other IOSH channels for details about our next webinars. I'm grateful to you all for joining us and taking part, and for your fantastic questions. So please take care and stay healthy.
I'm off to feed my birds. Penny and Paul, they're pigeons, just in case you're wondering. There you go.